Neurology. In this, we will discuss the drugs first. 5-HT3 antagonists, which are ondansetron and palonsetron, these act on the CTZ of the medulla oblongata. Now, palonsetron has lesser effect on the QT interval. Both adverse effect is increase in the QT interval and constipation. This also increases the risk of polymorphic VT. Baclofen, this is an agonist of GABA receptor and it acts on the central nervous system. Now, primarily the site of action is spinal cord by depressing the monosynaptic and polysynaptic transmission. It increases the potassium conductance and inhibits the calcium channel. Okay? This is used for multiple sclerosis, cerebral palsy and spinal cord. Now, abrupt withdrawal of this can lead to hallucination and autonomic dysreflexia. Carbamazepine, this binds to the sodium channel to increase the refractory period. Okay? Now, it is used in partial seizures, trigeminal neuralgia, in bipolar disorder, contraindicated in absence and myoclonic seizures. Adverse effect is P450 enzyme inducer. It causes leukopenia or granulocytosis, hyponatremia secondary to the SIDH. It binds to the sodium channel bispiride. Important thing is autoinduction. Now this requires increase in the dose to maintain the same therapeutic concentration because it auto-induces itself. Okay? Now we come to ethosuximide, which is used in absence seizure. What it does, it blocks T-type calcium channels in thalamic neurons. Okay? Ergotamine, this is the side effect is ischemia, gangrene. This is a coronary vasoconstrictor. What it is used in chest pain, arrhythmia. Contraindicator, peripheral vascular disease. It is serotonergic, dopaminergic, noradrenergic. Therefore, it will cause excitement, confusion, paranoia. It is also an CYP3A inhibitor. Okay. Lamotrigine, this is a second generation anti-epileptic drug. It's used mostly for partial seizures. It is a sodium channel blocker. Main adverse effect is Stevens-Johnson syndrome, for which they'll ask you questions. Side effect of phenytoin, it binds to the sodium channels and increases the refractory period like carbamazepine. Now, adverse effect, again, this is an inducer of the P450 enzyme like carbamazepine. Now, what are the adverse effect of phenytoin? It is acute. It causes dizziness, diplopia, nystagmus, slurred speech, ataxia, confusion, seizures. Chronically, it causes gingival hyperplasia, increases the PDGF, hirsutism, coarse facial clinical features, drowsiness, megaloblastic anemia secondary to alternative folate mechanism, peripheral neuropathy. It increases the vitamin D metabolism and causes osteomalacia, lymphadenopathy and dyskinesia. Idiosynchronization, fever, rash, toxic epidermal necrolysis, hepatitis, Dupuytren's contracture, aplastic anemia, drug-induced lupus. So all these will be there in phenytoin toxicity. Now, teratogenic effect, it is associated with cleft palate and congenital heart disease. Now, no need to monitor and check the trough levels immediately for phenytoin. If you do need it sometimes while changing the dose, or then you do it immediately before giving the dose. Now, phenytoin induces vitamin K metabolism and it decreases the vitamin K, and therefore it can also cause hemorrhagic disease in newborn. Okay? It increases vitamin K metabolism and vitamin D metabolism. The two vitamins metabolism, it increases K and D. Now we come to sodium valproate. Now this is the first line for generalized tonic-clonic seizure, except in young women. It increases the GABA activity. Adverse effect, it is teratogenic because it causes neural tube defect, neurodevelopmental delay in children. Now this, unlike others, is a P450 inhibitor. Okay? It is in GIT, it causes nausea, it increases the appetite and causes weight gain. Alopecia, regrowth, may be curly in this case. Now remember that phenytoin causes hirsutism and this causes alopecia. Again, in sodium valproate toxicity, like phenytoin, you have ataxia, tremor, hepatotoxicity, and pancreatitis are exclusive to this. This causes thrombocytopenia and hyponatremia. So, hyponatremia, sodium valproate. Hyperammonemic encephalopathy in sodium valproate is very common, and the treatment is levocarnatic. ठीक है. Rhabdomyolysis is caused by clofibrate, aminocaproic acid, HMG coenzyme reductase inhibitor, and neuroleptics, which will cause NMS. Topiramide, again, this will block sodium channel, increases the GABA, and it is also a carbonic anhydrase inhibitor. Now this is again P450 enzyme inducer of CYP3A4. Those were P450. Hormonal intraception less effective. ठीक है. Anything which is going to induce these enzymes will decrease the effectiveness of hormonal contraception. Adverse effect, it decreases the appetite and weight loss, unlike sodium valproate. Dizziness, paresthesia, lethargy, poor concentration. We come to levodopa. Now this is no use in neuroleptics induced Parkinsonism. So the drug induced Parkinsonism में इसका कोई काम नहीं है. Adverse effect, it causes dyskinesia. There is on and off effect. There is postural hypotension, cardiac arrhythmias are there, nausea and vomiting, psychosis, reddish discoloration of urine will be there. Triptans 5-HTD, 5-HT1B. ठीक है. So adverse effect, tingling, heat, tightness, contraindicated in ischemic heart disease and cardiovascular disease. ठीक है. So it is going to act on 5-HT1D and 5-HT1B. These are agonists. Vigabatrin 40% visual field effects. Check every 6 months. Epilepsy, pregnancy and breastfeeding. Take 5 milligram of folic acid as and when decided to get pregnant. Carbamazepine is the least teratogenic. Phenytoin causes cleft palate. Lamotrigine dose needs to be increased in pregnancy. Breastfeeding safe for all anti-epileptic except barbiturates. Taking phenytoin, give vitamin K in last month to prevent clotting disorders in newborn. Fingolimid, ceramide synthase inhibitor used in multiple sclerosis. ठीक है.